Hello, I'm Solomay Tibabu, the host of the Going Digital Behavioral Health Tech Conference. I am delighted to introduce Kevin Dedner, CEO and founder of Hurdle Health. Welcome, Kevin. How are you?
I'm great, Solomay. Thank you for having me today.
Why don't we start off by sharing a little bit about what is Hurdle Health and background about yourself and how you got into all of this?
Yeah, that's a great question. First of all, let me just thank you, Solomay. You've been such an advocate and supporter. I remember when I first started our company a couple years ago under the banner of Henry Health, I called you. Someone recommended that I have a conversation with you, and even then you were encouraging. And so I just want to thank you for the work that you're doing to make sure that everybody has the access to mental health that they need. I sort of come to this conversation through my own personal experience. Several years ago, working as a consultant in the public health space, I had a thriving consulting practice, but I worked myself into mental exhaustion. And before I knew it, I was in a period of depression. And I ultimately went to my primary care physician and told him that something wasn't right. And I will never forget that he came back to me with a 7-page printout, 3 columns on each page of therapists who were in my network. And that was the beginning of my journey in mental health. And I ultimately saw 3 therapists before I found a therapist who I could connect with. And I connected with that therapist, knew something that was different about how we interact with each other. And I thought I would go back to growing my consulting practice when my co-founder asked me a question. And the question was something that really changed my life. He asked me that on October 24th of 2017. And that was, have you ever considered doing anything in digital health? And it was in that moment that at that time, Henry Health was born. Today, we rebranded our company, and our company now is Hurdle Health. So what we are the leading culturally intentional teletherapy provider. We train our therapists in an evidence-based technique that helps them develop cultural humility and cultural responsiveness. We also are vertically integrating into our mobile app daily motivational messages and meditations. You know, what we often refer to as the self-care market. Those things traditionally have not been connected to mental health. I see mental health as a spectrum. And it's really important that people have, touch points to maintain stable mental health. So, Solomay, we meet at a soberly affirming time. We are seeing an unprecedented increase in treatment-seeking behavior, particularly in African Americans and Asian Americans. And our company is really blunt in our assessment that the mental health care system, as we know it, was not designed for everyone. It was designed for middle-class white families who have experienced trauma, which is why we take the approach of training our therapists to make sure that they can support whoever lands in front of them.
Yes, thanks for sharing that. I'm glad that you decided to pursue digital health entrepreneurship when you did, and exciting to see all of the incredible growth of your company and how many individuals you're serving as a result. As you alluded, challenges for people of color accessing mental health care have already been huge. And then, of course, the pandemic, numerous racial injustices, it's just top of mind for many, especially a lot of digital behavioral health vendors talking about diversity lately. What do you think about that? And how does that compare with some of the work you're doing?
Yeah, well, first of all, thank you for your question. It's a very thoughtful and timely question because, as I alluded to, we are seeing the largest increase in treatment-seeking behavior for African Americans and Asian Americans that we've ever seen before. And at the same time, the CDC is reporting that 40% of Americans are experiencing a clinically diagnosable condition. So, these are sort of dangerous times with serious consequences. What I always sort of use myself as the best example. When I started seeking care, what I found, my experience in trying to find a therapist and having 3 failed attempts is not unique. In fact, 50% of African Americans terminate therapy prematurely because of what we call the lack of therapeutic alliance or provider fit. That number, by the way, is 33% for the general population. So, Solomay, some of at least one of the persons who I sat in front of for therapy, in failed therapy, I should say, looked like me. So this idea that, which is, I think, a very dangerous proposition that is happening in the market, people are discussing it and they even brag about it, and that is that they, quote, match. I think is problematic because matching makes some assumptions that, because people look alike, that they're going to share the same bank of experiences and culture nuances. And, to go a step further to your question, even more specifically, just having a diversity in your workforce is simply not enough. I believe that what we're doing in terms of training our therapists in an evidence-based technique that's proven to improve their cultural humility and responsiveness is far superior to matching people based on race and demographics. Less than 4% of the therapists in the country are people of color. If we continue to see the trends that we're seeing in treatment-seeking behavior, we are inadequately prepared workforce-wise to serve people, period. So if you try to add the dynamic that you want to match people based on demographics, you've added a much larger challenge. So what we need to do when we talk about mental health in our country, we need to be brutally honest and face the hard truth that we literally are building on top of a history where people at one time believed that African Americans were too simple for talk therapy, right? Now, that is a sobering reality to hear, but if we approach care without acknowledging that and simply trying to make sure that we have only more Black and brown faces, that is super problematic. I think it is intellectually dishonest and disingenuous at best.
That's really helpful. Thanks for sharing that. And so I'm interested in learning more about your approach and how you're developing your provider network to be able to do all of this. What are you learning? What kind of insights are you gaining in the therapy sessions that you're delivering today?
Yeah, first of all, we're really proud to have as an advisor to our company, Dr. Norma Devines. And Dr. Devines is a professor at Hopkins and has been teaching counseling all of her career. And so, the technique that we train our therapists in is, I am a product of that technique. Remember, I'm always going to go back to myself as the best example here. When I found myself on the therapist's couch and something was working, I knew that there was something different about how my therapist was approaching my session. When I started the company, I went back to that therapist. His name was Dr. Tony Spann. He was our first clinical leader. And I asked him, what were you doing? And I need you to come help me replicate the experience that I had in therapy with you, because I knew that there was something very unique. What I would ultimately learn is that he was using this technique that he had been trained through Dr. Devines. And so I'm super proud that that's the technique that we train our therapists in. Our very best therapists, Solomay, who are trained at the very best schools, are often, they have one class devoted to dealing with Hispanics, one class devoted to dealing with brown people or African Americans. And if you just think about the complexity of our culture, we know that that's not sufficient. So what, when we think about how our therapists are, interacting with our clients, I'm so proud, to say, number one, we're experiencing consistent growth month to month. But more importantly, like our highest source of clients is direct referrals. And what we're seeing with our clients is they are persisting in therapy 8 to 9 sessions, which is 2 to 3 times the national average. We've also recently did an assessment or asked our current clients to give us on a 5-star rating to give us a score of their experiences. And what we've seen is 96% of those clients gave us a 4 or better. So, we know that that therapeutic alliance that our therapists are forming is really significant. And lastly, the other thing that is important to mention that we're learning is on self-reported mental health issues. We're seeing a correlation between the increase in the number of sessions that people attend. They start to decrease on their self-reported symptoms. So we know ultimately, what does all of this mean? It just sounds like, sort of just a lot of data points. What this means is that we can ultimately help people return to work faster, that we can help them manage their stress and be more productive in the workforce. For people who might have comorbidities, we're going to help them get to a sense of self-agency much better so that they can manage whatever disease state that they might have. And this is super important, Salome. We talk about mental health a lot, you and I, when we're together. But I am at heart a public health person. So, I think about the comorbidities, particularly that are associated with mental health issues. We see a high propensity of diabetes, a high propensity of obesity, all directly correlated. Like there's a, high correlation between the two. So I think, what the future looks like, and I'm sort of teeing up your next question for you. We're really at a tipping point culturally in our country. And this tipping point has been brought on by first the pandemic. But Salome, we cannot ever, in a historical context, have a conversation about the pandemic and not talk about the death of George Floyd. I think that the two events are historically tied together. Because had it not been for the pandemic, the stillness and the alertness of our country may not have been at the death of George Floyd. And obviously, after the death of George Floyd, we've seen this racial reckoning, not just across our industry in mental health, but we've seen this reckoning happen, all across the board in so many industries. So, mental health now, I think more and more people are understanding that it is a part of what it means to be healthy. Stigma is diminishing. Not saying it is totally gone, but it's diminishing. And, the other thing I would just say about this, because I think this is a really important point that we don't talk about much. We often hear, or we used to hear rather, that Black people in particular would not access mental health because of their culture, the stigma, our religious beliefs. I am just here to push back on that narrative that that's not true. What we're learning, each day we learn this lesson, is that the truth is Black folk were not offered mental health services. So how can you access and seek a service that was not offered to you? And so what we're learning about our brand by trying to build a very authentic brand that speaks to people that they can see themselves in, they respond to that brand.
Thanks so much for sharing that, Kevin. In fact, can you talk a little bit more about how consumers raise their hand and enter into your program? What channels are they coming in from?
Yeah, well, Solomon, that's a great question, and I'm really glad you asked that. When we started the business through like a B2C approach. We were selling directly to consumers. We still sell directly to consumers, and I think that that's a door that we should always leave open. But in our country, the gatekeepers to access to health insurance are employers and payers. And to make sure that our offering is available to everyone with the institutional funding that we brought on at the top of the year, we have been adjusting our business to sell to employers and payers. The idea here is that everyone should have access to the services that they need. And we've done some really meaningful work policy wise on parity. I've recently been in some conversations with Patrick Kennedy, and I'm so proud of the work that he's done to make sure that we've had parity. But the truth is that there are not enough solutions that work for everyone. Remember the number I shared with you earlier, 50% of African Americans terminating therapy prematurely because of the lack of therapeutic alliance provider fit. So, what's my goal and what I wake up every morning trying to figure out is how do I build a scalable company that's offering therapy in multiple states? And the fastest way that I think that we get to making sure that that offering is there for people is through working with their employer and their payer.
Outside of connecting with a therapist, do you have any additional resources for consumers?
That's a great question. Again, one of the things I think about mental health is that there should be a spectrum of services. And again, I think that this is something disruptive in terms of our vision of our product, and that is the vertical integration of self-care tools such as daily motivational messages and meditations with access to teletherapy. So, our vision is that our clients will be accessing their meditations as well as daily motivational messages in between their sessions with their therapist. And if you think about that right now, if they're for those who sort of use those tools, they're moving back and forth between 2 or 3 apps to meet the needs. And so, the ideal is that, we can meet all of their needs in through one platform, one application. Now, clearly, we all know that talk therapy, teletherapy rather, is not appropriate for the most severe cases. So what we're talking about is low to moderate mental health issues that you can manage remotely. So I'm excited about that. I think, when I think about how I've managed my own mental health, my meditative practices in the morning, my journaling and so forth, and those things have been, really crucial in helping me manage my life in between my actual sessions.
Well, this is such an important solution, and as you said, disruptive, pretty unique to actually engage populations who have not been able to participate in mental health care. I'm really excited about it. What's your hope for the future of behavioral health?
Well, I think this is a soberly affirming time. Um, and, the public health person in me wants not just to build a solution, but to build a solution that works, that we can measure our impact and see, the improvement in lives. And when I think of, the trauma associated with daily living, the stress associated with daily living for people of color, um, I want to build a solution that matters. And I think that we are seeing the normalization of accessing mental health, but we have a lot of work to do. Our workforce is insufficient. We need to reinforce our policies to support mental health. And we need more innovators. There, I call myself an innovator, but more innovators like myself proposing, bold solutions that we can scale. This isn't like mental health isn't the same as selling some product that works for everyone regardless of how you design it. We're very unique individuals. We all have many differences. Our identities are complex, and we have to build a solution that's prepared to deal with the complexity of our identity as a country. I believe that what we're doing um, is following that path, is bold enough to meet like that demand. And I think the future will measure whether or not, I'm right about that.
Excellent. Thanks so much, Kevin. As always, so inspiring. I would agree with everything you just said, and I'm excited for everyone in the audience to learn more about hurdle health. And as always, appreciate your time and insight.
Well, I'm so grateful for your leadership and what you're doing in this space as well. You are a credit to the entire ecosystem of thinkers and doers. So thank you, Solomay, for your leadership.
Thanks so much.